Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. In here, we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Oh, sorry. Hello, hello. Welcome to our Tuesday show. My name is Abby. I am your host. Um, Hoping everything goes well with technology tonight. And if it doesn't, I would just record on my phone right after this. Okay. So, but hoping everything goes well. If you can hear me out there, please just kind of say, yes, I can hear you and everything going well. Alrighty. So again, welcome to our Tuesday show. We're into our ninth season. Welcome to everybody who's joining me tonight from Abby Tyler's Healthy Living page in the group, and also Focus on Liberia, and also YouTube. Okay, please share the show. Please share the show. Again, I'm trying to raise money to put it back into the show because I bring evidence-based information and try to gather that information that will help me much. But if you can do that, please share the show, because at least that way, when you share it, other people who may be relevant to a certain topic, that can help them. Okay. So, as always, I am a provider, but I'm not your provider. So please do not make any changes to your regimen without first checking with your own provider. Alrighty. So let me just come in here. Let me just see. Make sure that I'm getting it. Yes. Okay, Moses. Thank you, Moses. Thank you very much. Okay, as you can see, today's topic is, how does high cholesterol affect you? Okay, so high cholesterol is also the scientific name for that is hyperlipidemia. Okay, so let me just put this there and get my thing showing there. And I'm gonna save. And okay, so we'll be talking about high cholesterol, and a lot of people have high cholesterol, like especially in communities where people eat a lot of rice and mashed potatoes and pasta and all that, and bread and all those different stuff. They carry a lot of high cholesterol. So cholesterol is like fat in your blood, lipids. Okay, so when that goes into your blood, let me just give you a little background first. Okay, so everybody needs a certain amount of cholesterol, right? Because you need it for your body functioning. It is produced by your liver. It's important. It's critical in building blocks for the body's function and vitamin producing hormones and your digestive fluid and all that. Meaning you need that, the part of your building blocks, in order for your body to function well. What happens is when the cholesterol, when it hooks onto the LDL, which is a bad part of the cholesterol panel, if it hooks onto that, and it causes, and it goes all over your body, because it increases the cholesterol in your body that's not supposed to be, is outside the range. We have a certain range that you have to go by, and it's outside that range. And because of that, it carries that and it builds up in your body, the higher level, and it form plaques into your bloodstream. Okay, because you have this little think about it, it's like a little tube where the blood is going through, the oxygen is going through, but with the plaques and the cholesterol, it starts forming in there. And because of that, sometimes when it clogs up and everything, that's what happens. You start having chest pain, and you're not getting the blood that you need, and not getting oxygen and all that. So it can cause chest pain or stroke. So just having high cholesterol, and you don't know that you have it until, most of the time, is like when you go to your doctors. Like I always say, go to your doctor, get your yearly blood work, so they can start checking on it, making sure, seeing what, if it's trending high, that way they can say, okay, maybe we need to put your medication, or maybe you need to eat healthy and all. If it's trending low, or if it's trending low, that's fine, but you need to be watching that every year. So, and sometimes when after you've had a heart attack or a stroke, or you went to the hospital for pre-admission testing for something else, or you just happen to be getting some blood work, that's when it's usually found, because usually there are no symptoms. Okay. So we call it LDL, low density lipoprotein. It's a really bad cholesterol. So we'll tell you when you get your blood work, the doctor will kind of explain everything to you on there. Okay. So what are some of the symptoms? There are no symptoms, but some people have. Let me just go in here for a second. Some people have like some like growth around the eyes. Let me open up my pictures here so I can give you guys a little bit more there. And okay, here am I. Okay, so this is me open this up. This is your bloodstream, okay? So your blood vessels and all that too. That's that yellow part you see over there. That's not supposed to be there. That's the cholesterol plaque when it stays into your body, in your blood vessels, and it start clogging up. So you see that how close they're coming together there. If you do watch this video again, you can just pause and just kind of figure where I'm going with my cursor. And then when that closes up, that's when you start, you start having chest pain and all of that. Okay. So like again, there's no symptoms until then. Okay. So but some people have a little bit of growth, like they say you can have some growth. Some people have like growth over their eyes and also, but most of the times there are no symptoms already. So I'm gonna go back here. Okay, alrighty. So when you go there, and sometimes people like they say have like a little bit of pain in their knees and all, but most times there are no symptoms. So unless if you like start getting to the point where you start becoming high in your bloodstream, and then sometimes when you get it done, when you get blood work done, and then they find out. Okay, so risk factors. What are some of the risk factors? Meaning, like, well, how are the chances? We are all at risk for having a high cholesterol, but some people are at higher risk. Like I always say, I talk about different disease processes and those who are at higher risk. Okay, if you have a family history of it, let's say, and most people do. Most people have a family history of high cholesterol and all that, because most of the times the kind of food that your parents eat, your grandparents eating over the time, sometimes your lifestyle choices and all that can put you at a higher risk for cholesterol. Okay. Unfortunately, some people have what's called familial combined hyperlipidemia, meaning if you have it in your family, but because you also have a partner that is, because some people will give them the medication, will do the blood work, and even they've been fasting for 12 hours before, and the blood work comes back and it's really high, and we do it again, we repeat it maybe 3 months or 6 months later, and it's still high. And some people are on the medication also. Okay, and it doesn't go down. So sometimes some people have the body traits that it doesn't respond to medication at all. So sometimes we have to, even if we put your medication, we also tell you have to eat healthy, you have to exercise and all that, but the body doesn't respond to the medication that we're giving, or it doesn't naturally stop the LDL from going higher. Okay, it doesn't respond to the medication that we put you. It doesn't respond to medication, to exercise, lifestyle change, and also we have to do a little bit of both and do a lot of other things to make sure that you stay healthy. Okay, because we give the medication. I'm going to get to the medications later. So if you have that, usually when we do the blood work a couple of times, then we know how to treat you differently from people who need just the medication and or to make sure you eat healthy and exercise as well. Alrighty. Also, another risk factors, the age. Let me get back to my banners here. Okay. So I'm doing the risk factors now. Okay. So age and sex. Okay. For as you get older, your body, you have a higher chance of developing high cholesterol, because as you get older, when you were like in your 20s and 30s, you could eat anything and it just got off your body just like that. Your body, your metabolism, your body's ability to break down food and get it out of your body, it was faster. Every part of your body worked faster than when you were younger. As you start getting older, that's just natural that your body will slow down, and everything will slow down over time. So of course, as you get older, your chances of developing high cholesterol also increases. Also for men on average also tend to have they have less good cholesterol. So the good cholesterol is the HDL. We call that a happy cholesterol. Okay. And women, so you have that up until like age 55, when your body starts to slow down too. Then you catch up with the men and your ability to like have high cholesterol. But a lot of people also have high cholesterol when they're much younger too. That's the familiar cholesterol I talked about. So that's why it's important that you don't wait till you're much older to start getting your blood work. I always say when you're in your 20s and all that, at least go to your doctors at least once a year, once every 2 years, depending on if you have other chronic diseases that you need to follow up on. Okay. So make sure that you're getting your blood work and you're checking that every year. If you have family members, it's always good to know your history too. And we're not just looking at that. We're looking at your family history. We're looking at lifestyle and all, because certain kind of lifestyle to the kind of job that you do. If you have a job that you're working and you're on your feet and you're moving around all day, like a basketball coach or somebody who's like moving around all day, chances are more than likely when you eat, your body is emotion, stays in motion. Things will move a little faster in your body. But if you have a desk job, if you drive a truck, or if you drive when you're sitting home or you're sitting still, sedentary most of the time, you are going to get, develop high cholesterol over time. Okay. So the older you get, the chances are more likely you're going to get that. Certain medical conditions too. Also, if you have diabetes, that also goes to that, kidney disease, pregnancy too, because you're eating more for more than one person. And sometimes you have to eat more after you have the baby too, if you're breastfeeding and all of that. Okay. Some people who have PCOS, a polycystic ovary syndrome, where those who have that, you have menstrual issues where you bleed a little bit more, or your body is not, you don't always have your period when you're supposed to get it. People, again, because of that, you have insulin resistance too, so you have a higher chance of putting on more weight, and also high cholesterol because your body's not breaking it down like it's supposed to. So most of the time, most of those people have to be on medication that kind of helps them kind of lose weight, or also help them with insulin, because most of the time they become diabetic as well. All right. And also your thyroid. I did a show on thyroid, your thyroid right here, the one that controls everything in your body, controls all your body functions. So if it's not working properly, if it's working hypothyroidism, if it's working lower, then that means everything's slowing down and you're not losing the weight like you're supposed to. And it slows down your body's ability to break down the food faster to get it out of your system. Okay. So, and then when certain medications too, and I don't like to mention some medications, because when you do that, then people will say, wait a second, but then why am I taking this medication if it's going to cause me this problem? Well, you need that medication. Let's say if you need this medication for your blood pressure, or you need this medication for your kidneys or something like that, you need that more than the cholesterol, because we can fix the cholesterol. Okay. But if you have something like with your kidneys, or you had high blood pressure before, or you had other issues, we can fix certain things, and there's a side effect of that. We can fix that too, but we need to fix the one that you're in more risk of like developing something more serious. Okay, so certain medications like water pills, some birth control and all that can also, because it puts on fat, people who are on contraceptive, you can put on a little bit of weight, and some other antidepressant medication too, anti-cholesterol medication that can also affect that. Sometimes it affects the liver too. So, okay. So it's important that you talk to your doctor, and if they put you on those medications, we also tell you, yes, you're going to be taking these medications. It may cause you some weight gain. It may cause you some cholesterol increase as well. But it's important that you go ahead and also live a healthy lifestyle. Okay. It's the same way when people will tell you, I want to smoke. I want to stop smoking, but I know if the minute I stop smoking, a couple of weeks, I will gain the weight. So I don't want to stop smoking. Well, your lungs are more important, and you can always work the fat off. Okay. But you can like get a new lung. You can, but you don't want to go through all that and lung cancer and everything else that comes along with it. So it's important that you do these things that, yes, we can fix this part, but we need to take care of the bigger part first. Okay. I'll be looking at the comments later on, and please let me know if I'm still on. Okay. Alrighty. And some healthy, I would say know your numbers, know your numbers, know your numbers. Okay. And also modify the modifiables. There are some things like you can't change your genes, the family that you're in, because, okay, let's say, yes, I have this familiar high cholesterol. You can't change what your DNA makeup, but you can delay it, and you can also delay the complications as much as possible. Okay. So let me go in here and just go in here. Again, if you're watching this later on, you can pause and then look at the numbers. So these are the numbers here you're supposed to be looking at. All right. So these are where the healthy cholesterol numbers are supposed to be. Alrighty. And then this is when they tell you this, you see when you're looking at your LDL, anything like around 100 to 150. Now we started worrying about that. That should always be under 100. And if you already have some other issues, okay, so this is where we really start worrying about, okay, there's something going on here, because this is where we know that, okay, you're talking about a heart attack issue. You're talking about you're talking about stroke and everything else that's going on. All right. So it's important also. And some people say, okay, well, I don't want to take any more medication, because if I take any more medications, then that means I'm going to, and it's like too many different medications. Talk to your doctor about it. And of course, like I always say, when we put you on these medications, we also follow up with, make sure you're eating healthy, making sure you exercise and do as much as you can, because sometimes the numbers, the medication that we put you on is maybe a higher dose and maybe lowered and lowered and lowered. And sometimes you may not need it after a while. Now, if you had a heart attack before or a stroke before, you may need that, because your chances of you having another heart attack, another stroke is always right around the corner. So they may put you on that prophylactically, meaning to protect you, even though you haven't, you had this problem, but to protect you from getting another one. Okay. So that's important. Sometimes they'll put you on aspirin, or to put you in and put you on some kind of medication too. The medications, I'm going to get to it later. Okay. So, the same thing, like if you're eating, okay, for health behavior, your dietary choices, if you're eating saturated fat, again, like I said, heavy bread, heavy mashed potatoes, heavy your cookies, all this sweet stuff every day, you eating that more, and eating that every day. Like I said, eat healthy food, eat your bigger food during the daytime, and then later on eat lighter dinner. So that way, because when you eat late, then you're going straight to bed, or you go into the rest. You're not getting up to go exercise. You're not moving around to clean the house and all. So eat really heavy early in the day, and then eat lighter food later on. Eat your breakfast and lunch like a king, and then eat your dinner and snack as a pauper. If you have to eat a late lunch, again, if you have diabetes and other reasons, to make sure you talk to your doctor, because people who have diabetes may have to eat like a nice snack later on in the night, so your sugar doesn't drop in the morning. Okay, so making sure you check on that, and exercising at least 30 minutes a day, of course. Already, physical activity. If you just staying around all day, you're not moving around, especially if you have jobs that you don't move around a lot. You want to get up and move around as much as possible. It's important that you get up and move around. Even like I said, if you work at a desk, you can stand up every once in a while, and you can get up and walk around the building because the weather is going to start getting a little bad on the outside soon, which I'm dreading, but get up and walk around, stretch your legs and all, because again, you don't want to sit down too long anyway, because your blood pools at the bottom of your feet. You can, when that breaks off, it clots off, it breaks off, it can go into your lungs or your heart or your brain. So it's important that you get up and move around. If you live in a house where there's stairs and all that, to get up and walk up and down the stairs. And even if you live in an apartment complex and you live and go up and down the stairs. If your apartment is like on the first floor, go up and down the stairs. You're moving your body, walk around the neighborhood, do everything that you can to stay active. Okay. And also being overweight too. Already, so I always talk about, a healthy fat. I don't fat shame anybody. I mean, you want to make sure you look at your body and see that you're healthy for your body weight. Okay, because you can usually tell, everybody can tell that, okay, yeah, maybe I put a little bit of weight on this side. Now, there's also other medications that can also cause you to gain the weight too. Things like steroids and all that can cause you to gain the weight. Certain, like, again, go into birth control, it can cause you to gain the weight. So you may be a little overweight, and the more you overweight, your body's packing all the fat in your blood cells and all. So you need to exercise so your cholesterol level doesn't go up. Okay, so stay at a healthy weight. I would say stay at a healthy weight. All right, smoking, especially smoking, now hardening your arteries and all. When the fat is in your bloodstream and all that, is hardening arteries, which is called arteriosclerosis. And when the fat is in your blood and all that's called atherosclerosis. Okay, so it's important that if you smoke, stop smoking. There's no redeeming quality in smoking, especially everything else that goes along with. So make sure you stop that, because why? And it's an addictive habit too. So it's not something where, oh yes, I'm shaming you because you smoke. Because they make it that way so you can be addicted to it. So if you can quit smoking, try as much as possible to quit smoking. It's called 1-800-QUIT-NOW. There's so many different resources out there. Okay. And alcohol, alcohol just increases your cholesterol and triglycerides level. No, so there's no redeeming quality in drinking alcohol either. So if you don't have to smoke, if you don't have to drink, don't drink. If you don't have to smoke, I mean, a little bit of drink here and there, that's fine. But if you're drinking heavily, if you're drinking heavily also, because somebody will be telling you that you're drinking a little bit too much. Okay, so quit. Try as much as possible to quit. All right. So I'm gonna take a little break here and just look at any comments I see so far. So Jerome said, another great topic. I am a walking dead man. My cholesterol is 160. No, it is the fact that you know that your cholesterol is that high. I'm guessing your LDL, it is really high though. So the fact that you know that, that's good. And you're hopefully, you're eating healthy, and everybody else is eating healthy in the house as well too. Because if you're the only person eating healthy and the other person, no. So the fact, just knowing that where you're supposed to be, that's good. You can start working off of it. But that is a really high level. So I hope your doctor's talking to you, and you have your own management going on there. Okay, and Don Theo said, thanks for the education. Thank you very much for watching. And Mike Hines, I appreciate advice and Miss for that. I appreciate the advice and info, Miss Abby. Thanks as always for the safety tip. Thank you. Thank you so much for watching as always. Okay, so how is it diagnosed? Let me go back to my banners here. Okay, so diagnosis is mainly for blood work though. So, you tell you, again, like I said, go see your doctor, your family doctor, your provider, your NP, your PA, who is your primary care provider. You go there, and every year we're going to be checking checking for your glucose too, okay? Because that high blood pressure, high cholesterol runs together with diabetes and all that too. So we'll do your routine testing. So we'll be testing your complete blood count. We're checking for anemia and checking for infection. We'll be doing your BNP, your CNP. We'll be checking your liver functioning. We'll be checking your cholesterol level, lipid panel. So the test is called a lipid panel. All right, and that's the one I told you before. So we'll do that and tell you what your total cholesterol, your good cholesterol, your bad cholesterol, your very bad cholesterol. So we'll be checking that. And the one our eyes are going to be zeroing on is that LDL, and also the triglycerides too, because we want to make sure nothing's going on with your pancreas. Your pancreas is the one of the organs that's on the left side of your stomach there. It's very important too. Okay, so we want to make sure that nothing else is going on there. Okay, so We'll do the blood work. They'll tell you make sure you fast first for at least 12 hours prior to getting the blood work. And if you go into your doctor's office for your physical, call for your physical that year, make sure you call first and say they're going to be doing the blood work there, because some places they do the blood work there and they'll tell you come fasting in the morning. So if you go in there later on and you know you're making your appointment later on the day, ask first if you need to fast, because you may be hungry. You don't want to be hungry all day, or just tell them, say, okay, yeah, I'll just go get my blood work done somewhere else. But ask first, okay? Because some places they do the blood work there the same day, and then they'll call you back for the results. If you don't hear anything back from your doctor's office, please don't just assume that everything is okay. Everything may be okay, but don't assume that everything is okay, because sometimes it takes a little while to call you back. Because remember, when you get your blood work, there have been other maybe 102 people who already had the blood work, and would take a little while to call them. Of course, anything that's really serious and alerting, and the lab would kind of tell us like, okay, yeah, keep it, look at this one first, all right, and then call the patient to talk about it. All right. So we'll do your blood work. And again, like I said, we'll do all of that. Check your liver function, check your kidney function as well, too, because certain medications also affect the kidneys. So we'll do all of that. And then based on your specific factors, your family history, the other medications that you're taking, the kind of lifestyle that you live. So your care, how your doctors is going to treat it, is specifically based on you, your individualized care. So somebody might say, well, wait a second, how come, I have this and then I give me that, or I have that and I give me that, and how come they put you on that, but they didn't put me on that? No, that just means that everything is individualized for everybody. It's not, okay, yeah, there you go, one size fits all, because again, we're looking at everything else too. Also, your blood pressure, we're looking at the blood pressure. We're looking at the blood pressure. It's important that you also have a healthy blood pressure too, because most of the time, high blood pressure, high cholesterol, and diabetes, the trifecta, they kind of go together. So we have looking at all of that too. Okay. And some people don't like to take too many medications. Most of the time, if your numbers are high, though, we'll tell you, okay, go ahead, eat healthy, exercise, and all that. And then we give you a chance, maybe 3 to 6 months, and then we'll repeat it. So it's not like, okay, yeah, as soon as I went in there, poop, they threw medications at me. So for my Liberian people, and, those are people that I know a lot, havoc is all rice, baba rice, and all those different stuff. They have the people say, okay, yes, the palm oil. Like I said before, you have to take one tablespoon of palm oil a day. Now, how many Liberian food have 1 tablespoon of palm oil? So it's not just picking on my people, because it's the one I'm more familiar with. Okay, fried foods. Stick away from the fried foods, especially like gravy. If you eat fried foods, don't make it something that's a habit that you fry in everything. You can boil most of the stuff. You can broil most of the stuff and put it in the food and all that. Exercising. Back home we used to do a lot more walking than we do over here. Okay, so and it's like they said, when foreigners come from different places and they acquire a certain amount of wealth, they're not as active anymore. And especially if you live in the part of the country I live in, it's 6 months out of the year, it's so cold to do anything. So if you can go to the wall, get to the mall and walk around, do that. Don't just drive everywhere. If you at work, you take the car, don't park it right close to the door, to the closest to the door. Park a little farther if it's safer, of course, and then walk to the door. Okay. So, and I understand, it's kind of hard, especially when you're adult, when you have the last thing you want to do is walk any fast, any farther than you want to, but just do as much as you can. Okay. So just give me 1 minute here for a second, and then we can start into the next part there. So just watch my little video. Yeah, bye. Okay, alrighty. So let me see if there's any comments here before I get to the treatment part. Okay. Let me see. I think I did my kinds. And your LDL is 80. All right. Yes, yes, yes. Okay, look at you all healthy. Good, good, good. Yeah. Let me see. Where's there? Is that what kind of life is this? I can't eat. You can eat all of that. You can eat all your papa, you can eat your fufu, you can eat all of that. It's just as long as you don't make it like a habit. Yeah, I know once your body's used to it, you've got to a certain age in life, you're not gonna go sit there and be eating salad and all those different things. I understand that, but you have to understand too that as you get older, it's important that you kind of modify all those things. You can't eat like you were when you're your 20, 30 year old, because chances are more than likely you're not getting up and moving around like when you were 20 or 30 years old, and your body has slowed down too. So so it's important that you don't do that. So you be eating all of that all those many years. So your arteries and all. So by the way, if you guys ever had any heart attack or anything in your family member, please make sure at least you're making one visit to a cardiologist a year so they can get your echocardiogram done. That's to do the ultrasound of the heart. You can do EKG. And also, when you're looking at somebody, you see little like veins shooting up over there too. That's important too. So make sure that you're getting an ultrasound of the carotid arteries, because those are the one that if that's filled up with plaque and all, that can block the air and the oxygen and the blood from going to your brain. That can also increase your chance of having a stroke too. Okay, you may not have any of those things and all that, and still. All right, but it's important at least you do a baseline testing on that. So it's important. Talk to your doctor about it and see if you need to see a cardiologist or have these tests done, and just follow up for at least once a year, or once, and then get your baseline testing done, and then you may not have to go back again. All right. But that depends, and that would be something you and your doctor would discuss. Alrighty, so getting back to it. So we've talked about the risk factors, we talked about diagnosis and all, and now we're talking about treatment. All right. So the treatment is most of some of the things I've already talked about. Alrighty. So limit your food, limit your saturated fat. Again, like, I'm not a dietitian, so hopefully I'm looking at getting a dietitian on the show. I remember, like I always said, we're in nursing school and they talked about dietitian and all this different stuff. We're like, oh God, because they go more in depth into it. And it's like, okay, we're talking about don't eat fatty food. You know the kind of food, especially those who you eat, like you take your bread, heavy bread, and you put so much butter on it. It's like, no, you can put a little film of butter on it. Make sure when you drink your coffee or tea, don't put so much sugar in it, because sugar is also bad for you too. Sugar is almost as bad as smoking, especially, and we like to put so much sugar in our food. I like to put a lot of creamer in my coffee, but I only drink 1 cup of coffee a day, and I put 1 spoon of sugar and I put lots of creamer, but it's not dairy creamer, and I need to cut back on that. If you cooking your palm butter, or you cooking yourself dry fish, smoked turkey, you want to do that. The goal is not fat. Put a lot of fish in there. Put a lot of fish in there. A whole lot less meat. Cow and all those different things. I know, like I said, we're Liberians and all. We put everything, every meat and so we put it in there because it makes the food taste good. It does. So we do have this Liberian restaurant where I work, and it's like so many American people go to it now, so they know how good our food tastes. But as good as our food tastes, you also have to exercise. You also have to eat less of it. You also have to like kind of modify it. Okay, eat brown rice. We just started eating quinoa. It's Quana. I hope I'm spelling it wrong, but that's good too. It tastes, and bugger wheat, all those different things. Okay, so you can mix that up. You don't have to eat all of it just with your soup. You can mix that up with a little bit of rice and all, and then as you get used to it, again, like I said, brown rice and white rice, you start putting 50 and 50, and before you know it, you put in 75, and then next thing you know, you're eating completely healthy. All right, so it's going to take a while, especially if you're for a person of a certain age, it's going to take a while for you to change all those habits that you learn and all. And it's not talking about anything against anybody food, because all the other different groups that eat unhealthy stuff, so we talk about them based on their cultural different things. Mashed potatoes, you talk about, and collard greens, all the like smoked hogs and everything else, everything heavy. So a lot of fish, a lot of dry fish, a lot of smoked turkey and things like that doesn't have too much fat on it. Okay. Also exercising. Like, you don't have to go to the gym. If you can go to the gym, that's fine. 30 minutes a day. It has to be at least 150 minutes or more. Heavy exercising where you're moving your heart rate, going for a walk, dancing. I mean, like I said, there's so many free stuff on YouTube. You can put it on, and all these TVs now, they're like so high tech where you can watch it on TV and really get the most that you want to get out of that. There's some stuff you can go on, and some cheap machines on Amazon, so you can get those. So, but there's so many things that you can do without having to buy anything, but do as much as you can. So you don't necessarily have to go to the gym, because some people don't have time to go to the gym. Like where I am right now these days, I really have the time to go to the gym. So I've been doing. I got this new thing of YouTube, and I'm doing that when women of a certain age. As you get older and all that too, everything kind of slows down. That's also for men, so don't just think it's just women, but it's important, okay, because when you have hormonal changes too, that also, you add fat to your body. Doesn't, and it's something where people say, oh my God, you got fat. Well, you went through hormonal changes, which is normal for a woman. So it's important, but you want to make sure you work on that fat because, of course, again, that increases your risk for a heart attack and also increases the risk for a stroke and everything else that comes along with having a high cholesterol. Okay, so exercise, 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 and the LDL. Make sure you ask your doc, what's my LDL? It's got to be under 100, right? And sometimes we want it, and if you had a heart attack before, we want it at least under 72. So it's important that you do that. Get your LDL. That's a dirty cholesterol, low down dirty cholesterol. You don't want that. You want HDL. You want your HDL to be happy. Because increase your HDL, decrease your LDLs. Okay, increase the triglycerides too. Also, if you drink, okay, that's really hard on your pancreas. Again, try to cut back on that. Alrighty. Weight loss. Again, exercising, get down to a healthy weight, get down to a healthy weight, get down to a healthy weight. You go to your doctor's office who do the body mass index, but that has come along with so much controversy over the years where people are like, okay, you're this tall and you're this short and you're this, but it doesn't take into consideration all the other factors that come along with it. So most people, it's a tool that we use. It's one of the tools that we use to measure your health, but it's not the tool that people used to be saying was like the primary one that we went on there with it. Now people will still look at it and say, okay, you're obese, partial obesity, stage 1 or 2 and all, but it's not the main thing that we look at anymore because it was invented way back and those criteria don't apply anymore. All right. Again, like I said, quit smoking. If you smoke, quit smoking. 1-800-QUIT now. You can ask your doctor. There's a patch. There's the gum. There's the pill. You can take so many other things that's going to help you quit smoking. All right. And then we come to medications. Let me see here before I go into medications. I think I got that. How about honey? You know what? Because does the honey have the dietary thing on the bottle? Because most people buy honey and there's nothing in the bottle. They buy it from another person. So as long as it has the dietary facts on the bottle, they're telling you how much you're supposed to take per day and all. Because again, like I said, when people say, "Oh, I just take this, I just take that," if it doesn't have the dietary fact to say how much you're supposed to be taking, then it may not be healthy. Because some people take. My uncle used to do a lot of honey back home, and people would like dip that in there and make that so sweet. It's like drinking sweet tea. When you're drinking sweet tea from these restaurants, it's so sweet. It's like, oh my God, I can taste it on my tongue. Why is it that sweet? Okay, and if you're gonna get sweet tea from the restaurant, also don't get the big one. I know, like when you go to one of those fast food restaurants and 99 cents, and you can get like a whole bucket full of sweet tea. That's too much. If you have to do that, get that, put some water in there, dilute it a little bit. Even for my drinks that I have at home, when we buy like grapefruit or whatever, I open it up and we pour water in it and half and all that long before the kids are aware of it, because sometimes if they're aware, they won't drink it. Okay, so my son's up to it. He knows now. And what is that? Honey in your coffee instead of sugar. Can you put honey in coffee? I don't think I've tried that before. Again, as long as it has the dietary facts on there, then yeah, you could do that. Alrighty. So, but honey, the way we should like just dip it in before back home as you get older. No, honey is not all that good for you all the time. But make sure, like again, the dietary facts on the back side there, you can see that on the bottle. Okay. Alrighty. So let me get back here to treatment. Okay. Alrighty, so some of the medications we do is called one of the main ones that we do first and foremost. And as always, even if we put you on medication, we tell you to eat healthy and exercise. And also the medication that we put you on is called statins. Okay, you've seen like on TV where you see commercial for Lipitor, that's atorvastatin, pravastatin, and all those different medications. Okay, those are the ones that help in reducing the amount of cholesterol that's made by your liver. Okay, and it's important because it reduces, again, like I say, it reduces the risk of cerebrovascular accident, your CVA, your stroke, and all the cholesterol capabilities. And also, so there's the one that's been clearly shown to do all of that. So usually we start you on that. Again, individualized care. So you may not be your candidate for statins. Sometimes we put you on omega-3 fatty acids, so you can buy that over the counter. Also, please make sure you talk to your doctor about that too. So if the numbers are like kind of borderline, that's what I'll do. I was like, okay, let's try some omega-3. If you don't have any other major risk factors, we'll try some omega-3. We'll actually to exercise and all that. And then we'll come back in 3 to 6 months and tell you, okay, yes, let's do that again. Let's see what the numbers are. If those numbers are not too healthy and I'm looking at you, everything else that comes along with it, again, your family history, the other medications you're taking, your past history and all of that, okay, all the other risk factors, if it's still there, we might say, okay, we're going to have to start you on statins. And if we start you on statins, well, we started the lowest dose. And also we're looking at your blood work to see, okay, maybe this person who they have the cholesterol from their family, the kind that I talked about before, where it doesn't respond to it. It's like you're giving the medication to get to statin to go in there, but something's like blocking it from working. So it's not bringing back your number, down your numbers. So we have other ways to work around that. And as always, you want to make sure you're exercising all the time to staying as active as possible. All right. And there's other stuff to the policy questions. I'm not going to go into the major one is statins. And like I said, omega-3 acid, niacin, we kind of add that because sometimes if that's not working, we kind of add additional medications to it too. Okay. And again, looking at other medications that you take into. Alrighty. So, and also if your triglycerides are high, because if it's too high. Now these numbers are really, really high to where we're like, okay, this is really alarming. We may have to do like an ultrasound just to make sure nothing else is going on with your liver and nothing else is going on with any of your major organs are in your body there too. Okay. So we do that and we say, okay, everything's fine. You don't, nothing, you're not drinking, you're not taking too much Tylenol, which is acetaminophen too, because that can also affect some of the numbers too. You're not drinking that much. We ask you all these different questions. Okay. And then we can go on your train with your treatment. So we'll go with your treatment plan. All right. So, and you know, I mean, like, it's like important. Okay. You go ahead. We want to make sure we keep you down below 100. And depending on your history and anything else, stroke and heart attack in the past, we also want to keep you down below 70 or below. Okay. So it's important. It's important. So it's most important thing is like knowing your family history. Know your family history. Know your family. It's like, well, you know, by the way, you got high cholesterol. What are you taking for it? Or when were you diagnosed with that? Did they ever tell you that maybe you have one of those cholesterols that don't? And if you have, you know, I know Abby said maybe I may be at risk for having a heart attack if my numbers are high and all that too. So by the way, doc, what's my number? Because they'll tell you, okay, everything is okay. Alrighty, well, what's my number? So like I always said, when you get your lab work done, sit there, let them explain it to you. What does this mean? What does that mean? What does that mean? Okay. Oh, you say you're looking good. Oh, say you're borderline. Borderline as in what? Like, what am I borderline as this one? Borderline as in I need to do a lot more. Borderline as in do I need to start taking medications or do I need to be worried about something? Like I always say, when do I jump off the ledge? When do I meaning that? Okay, when do I sound the alarm to saying something's wrong going on here? Oh, I've been having chest pain, and especially if you're having anything like that, of course, you want to always go to the emergency room right away with chest pain and any kind of dizziness and shortness of breath and all that. You want to go to the emergency room. So bottom line, know your numbers, know your numbers, know your numbers. Modify the modifiables. Okay. Things that you can change, go ahead and change them. Things that you can't change, try to work around it. The most important thing is you want to keep those numbers at a healthy place so you can also stop any kind of complications. Okay. Because if you have a heart attack, you could die from it, or it changes the livelihood. We all live in America. We all live in places where you have to work. Even if you live in places where, if you're independently wealthy and all that, so you still want to be able to have like a good lifestyle. You don't want to have all that money and be laying somewhere while somebody's taking care of you, especially if you're very, very young too. Okay. And very, very young is like very young. Some people who are like 99 years old and they're still good, that we say a good 99 years old. So especially when you're so young, you have children, you have a whole life ahead of you. You want to live it healthily. And also heart attack too, strokes. So always I was the risk factors. They always say like, African American and all that. But if you eat healthy, if you don't eat healthy, and the kind of food that you eat, the kind of lifestyle that you live, that puts you at a higher risk. I don't let you say one race because everybody's at risk. Some people are at a higher risk. Okay. So it's important that you do that. Exercise, know your numbers, modify the modifiables. So again, know your numbers, know your numbers, know your numbers. Alrighty, let me just see here. I think I wanted to show another picture here. So when you're watching this again, you can pause. All right. This is the blood pressure where it's supposed to be. This is your normal blood pressure because again, like I said, that comes along with that. The blood pressure. When they tell you this, the blood pressure, the one's supposed to be up there. This is the one that's supposed to be low. So we start looking at when it starts getting into this red zone, we start getting really concerned. Okay. So it's important that you do that. And of course, again, this also goes with having a stroke. And also this is your, any imbalance. If your eyes, you're losing your vision, your face droop, your arms weak, slur speech. And when did the symptoms start? Of course, especially for stroke, they're going to ask you, when's the last time you saw this person? And were they okay? What were they acting at? Because you only have a short window there, 3-hour period, where if you have anything going there and they check and see, they can give you the medication that it can bust out that clot. If there's a kind of stroke that you're having and increases your chance of you recovering and going back to your life as well as possible. Okay. So it's very, very important. High cholesterol. The other name is hyperlipidemia. Know your history, know your numbers, modify the modifiables. Know your history, know your family history, know your numbers, modify the modifiable. So when you're sitting there tomorrow and you're eating a nice bowl of soup with everything, or if you're eating mashed potatoes or your big bowl of pasta and all that, you'd be like, did I eat big bowl of pasta yesterday, the day before? What did I eat for breakfast? Did I eat something with bread? What am I eating for dinner? So kind of, incorporate some salad in there every once in a while, just eat something healthy, eat your fruits and vegetables, especially your fruits and vegetables and all that. And then make sure, look at your can and all that, look at the dietary factors, information on things that you're eating. If you're eating salad, of course, don't dip the salad dressing too much into it, put a little bit there. You can eat healthy salad dressing, of course. Now I know I'm saying, oh my God, if you're eating healthy salad, I gotta eat healthy salad dressing too. It's important. Okay, as you get older, it's important. It's important. It's important. Okay, so let me see if there's any more comments here. I think Jerome said, my doctor, I think my doctor's so smart. He says I'm very healthy, but he took away my food. He took away my food and rice, there, but he said I can eat the potato greens with olive oil, no meat. Oh yeah, that sounds like a very smart doctor. If he took away on that, that's why your LDL is 80. Yeah, you're healthy. It's like your total cholesterol. I think he was talking about the 160, and that's below 200. So yeah, you're healthy. And he took away all those things. I hope he didn't take it away. I'm sure he told you just to kind of cut back on eating it. Not taking everything, because we want you to live a good life. And sometimes even when I'm eating something too, my husband fixed stuff, and I'm like, that has no taste. He goes, oh yeah, Abby Tyler, healthy living. Let me come and see you eating. I was like, no, I don't mean I eat healthy all the time. You want to live life. You want to enjoy life. Okay, there's so much to life, and just eating like a celery stick all day. But as you get older, and your family history, and your history and all that too, so it's important that you change things around. The same way how when you were younger, you could do so much, you can do so much, and you'd be like, I'm not going to a party that's ending 2 o'clock in the morning when I know I have to go to work. Yeah, when you were like 20, 21, 25, you could go to a party when it was like ending 2 o'clock in the morning, and you jump right out 7 o'clock, and you were at work and you're wide awake. You try to do that now, you're like, okay, 10 o'clock, like, wait a second, when are we going home? When is this party over? So your body, as you get older, things are going to slow down naturally, which is natural. So cut back. And I always tell people, if you're eating food for the appetizer when you go to a party, don't eat a whole bowl of rice for the for the main course. Try to cut back. If you're gonna eat a little bit of fufu, then eat a little bit of rice. Alrighty. So, and those who eat mashed potatoes and pasta and heavy bread, with heavy in the dressing, heavy on the butter and all, try to cut back. Exercise 150 minutes a week or more. You can do dancing, you can do free stuff from YouTube, you can do so much more. If you can go to the gym, that's fine. Like I said, Planet Fitness, $10 a month. Cancel anytime I feel like I'm to pay me to say this, but that's what I go to. The other places have more amenities, but Planet Fitness, I go to it because it's like, again, when I get the chance, I go when I can find the time. I got a couple of exercise equipment recently, so I've been doing that at home now. When I get the chance, I'll go back to Planet Fitness. So, but right now I'm just doing most of my exercise at home. I wake up in the morning, I do it. I come home, I do it. All right. So I didn't mean to keep you guys for so long. Let me go back here. I don't think I see any other questions here. Alrighty. So again, thank you all for watching. Again, know your numbers, modify the modifiables, know your family history, do as much as you can to stay healthy and stay alive for much longer. There's some things that you can cure. There's some things that you can help, because your body will just turn against itself and all that too. I'm not talking about that. I'm just saying, as much as you can, try as much as you can to do that. If they give you medication, take the medication. If there's some side effect to the medication, please talk to your doctor. Some people have issues with statins and all that too, okay? Because sometimes it affects the bones and all that. So you want to go follow up to get your blood work done, check your lipid panel done, check your liver enzymes too, because sometimes it affects the liver numbers too. So that's why it's important when you take the medication. They say come back in 3 months. We're not just doing it just to take your money. We want to make sure that if you're taking this medication, we may have to reduce the dose, or we may have to change the medication around. Okay, and do all those things to stay healthy, because if your blood pressure is high, your diabetes high, and all that too. And for men, that also causes your ability not to be able to function properly in the bedroom. So, ding ding. So okay, so if you smoke, quit. If you drink, quit. All right. So for those of you who are watching now, I say thank you. For those of you who will be watching later, I say thank you as well. Please share the show. Please share the show. Please give me a thumbs up. And if you have any additional questions, we can continue it in the comment section. I always read later on, and then I answer my questions as I go along. Okay. So thank you all for watching. I appreciate it. Good night. God bless.